So, good morning. I'm Allison Arwady. I'm the commissioner at the Chicago Department of Public Health, and we are really excited to be giving our second doses of COVID vaccine here in Chicago. So I think what we'll do is just maybe quickly do a quick round of who everybody is and just your name and your role, and then we'll go ahead with the vaccine, and I'll talk a little bit about why the second dose is important and what we should be thinking about while that's going on, if that sounds good to everybody. So these are the same five who got their first dose of vaccine 3 weeks ago at Loretto Hospital. This is the second dose of the Pfizer vaccine, which does need to come 3 weeks after the first dose. So let's just do a quick round of introductions. So getting vaccinated.
Good morning, Marina del Rios. I'm an emergency physician at the University of Illinois at Chicago.
Great. And then vaccinating.
Good morning, Dr. Abha Agrawal, Chief Medical Officer at Norwegian American Hospital.
Thank you. And getting vaccinated.
Good morning. Barbara Shields Johnson. I'm the Director of Nursing Services at Loretto Hospital.
Perfect.
Dr. Dagoberto Camacho. I'm the Medical Director of Ambulatory Services at Norwegian Hospital.
Good morning. My name is Elizabeth Zimney. I'm an ER nurse at Norwegian American Hospital.
Good morning. My name is Rosa Miranda. I am the Employee Health Supervisor here at Norwegian American Hospital.
Good morning. My name is Jamila Hill, and I'm a patient care tech at Loretto Hospital.
Good morning. My name is Dr. Henry. I am a family medicine resident.
Wonderful.
My name is Mark Hooks, and I'm an emergency room nurse at the Loretto Hospital.
Bertha Nunez, telemetry nurse at Norwegian American Hospital.
All right, perfect. So thank you to all of you for being our ceremonial first folks to get vaccinated, and I think we can go ahead and get started. And I'll just talk through a little bit while this is going on. So the second dose, we'll let you get that first one first. Yeah. We'll go one by one, yeah. Mm-hmm. All right, easy as that. Good. And go ahead to you. So the second dose is yeah, candy cane. I like it. You can go ahead. I'll talk while we go. The second dose is the same vaccine. It's the Pfizer vaccine, and it's the same dose. But it's important to get that second dose because with the first dose, your body starts to learn how to protect yourself against COVID-19. But this second dose is what really brings the more full protection. The researchers estimated that after the first dose, people are approximately 52% protected against COVID, and after the second dose, 95% protected. So we really consider that protection to have kicked in about 1 week, 1 to 2 weeks after the second dose. So these are our first people who will be considered really the most protected against COVID in Chicago. We can come back here. Thank you. We continue to follow people for any side effects after vaccination. Just as a reminder, I imagine some of these folks may have had some mild side effects after the first dose. Typically, those are a sore arm, or in some cases, people for a few days can have feeling tired or muscle aches. Perfect. We're at the fourth. And all of the safety monitoring that happens after the first dose also happens after the second dose. So you'll have the opportunity, if you want to follow with the CDC V-Safe, you can get text messages and report any symptoms or problems. We also always have on site at every vaccination center in the city of Chicago, no matter where you're getting vaccinated, there's protocols to monitor people just in case there were to be an allergic reaction or any other problems. And we have all the materials on site in case that were to happen. We've not had significant problems with that in Chicago or broadly across the country. I like the candy cane. Okay, go ahead. All right, We did them all? All right, so congrats, everybody. Thank you. And we will have you sit for the 15 minutes again, if that's okay. Congrats. Anybody want to just say anything quickly while we're transitioning?
So I'd say this is the best way to start the new year. And also, for a lot of Latin American countries, today is a holiday. It's the Three Kings. It's the eve of the Three Kings Day, so also best Three Kings Day gift. But thank you to both Dr. Arwady and Mayor Lightfoot for this opportunity. I think, again, for all of us, it's a relief. And also maybe some cautious optimism for the new year. So we appreciate this opportunity.
Absolutely. All right, and thanks to all of you. Congrats for being our very first second dose recipients. Perfect.
Good morning, everyone, and thank you for once again being with us to really witness history. These 5 individuals who received the vaccine this morning were the very first 5 people in the city of Chicago to get the COVID-19 vaccine. And what you've witnessed today is them getting their second dose. So congratulations. I hope it does bring you a measure of relief. I want to thank you on behalf of a grateful city for everything that you have done over the arc of this pandemic to really be there on the front lines, taking care of patients, being there for each other, really providing strength and support to your colleagues, both within your hospitals, but also outside of it. We know that this has taken a tremendous toll on a whole swath of Chicago, but particularly our frontline healthcare workers. So I feel honored and humbled to have witnessed this now twice. And I just salute you for everything that you've done. And I wish you the best in this new year. And as you said, what a way to start off the new year. So congratulations to you all. We now have a familiar group that is with us today. You heard initially from our incredible Public Health Commissioner, Dr. Allison Arwady. I want to thank Norwegian American CEO Jose Sanchez, Loretto Hospital CEO George Miller, and Dr. Geraldine Luna, the medical director at the Chicago Department of Public Health. You'll hear from all of them in a moment. What we just witnessed was our latest step in Chicago's vaccination journey, building on our plans to inoculate our hospital-based healthcare workers and expand vaccinations to our long-term care facilities and staff at outpatient facilities. And we've taken some big steps in these 3 weeks to moving forward on all those fronts. These are workers that have been treating COVID-19 patients in some of our hardest hit communities, and continue to provide the critical testing, care, and resources needed by our most vulnerable residents during these challenging times. We are intentionally here at Norwegian, thank you, which continues to be an invaluable safety net partner in our city to curb the spread of COVID-19 in predominantly Black and Latinx neighborhoods like Humboldt Park, which is where we are. And thanks again to CEO Jose Sanchez and the leadership team for your diligence, hard work, and sacrifice. As we are all aware, COVID-19 has left a disproportionate and devastating impact on Black and brown Chicago, many of whom are dealing with pre-existing conditions that make them particularly vulnerable to healthcare impacts like COVID-19. And these are too often the residents who don't have the luxury of being able to work from home, who may be working when they are not feeling well because they are fearful of what the consequences will be if they don't go to work, who don't have the luxury of being able to take off time because they're fearful of losing their jobs or reduced pay and need that income to be able to keep their families together, who may also be delaying seeking medical care because they don't have health insurance or can't otherwise afford treatment, or are worried about their immigration status. Make no mistake, these disparities are the result of decades of prejudice, discrimination, and disinvestment. And they do at times seem insurmountable, but they are not. They are not if we are dedicated and focused and intentional on bridging these divides. That's why I've made it my priority to take this pandemic as a once-in-a-generation opportunity that it is to build the permanent infrastructure necessary to ultimately eliminate these disparities once and for all. No one should be fearful. No one should not seek health care because they're afraid. We need to keep doing the hard but necessary work of making healthcare accessible and affordable and high quality to all who need it. It is a basic human right. Our equity-based vaccine distribution plan is the latest phase of this important work. In order for us as a city to both reach and reap the benefits of widespread community distribution, we need to secure the trust of our Black and brown residents so they feel comfortable receiving the vaccine. The fact of the matter is that many in our Black and Latinx residents have a very understandable skepticism about the safety of receiving COVID-19 vaccines, a skepticism that is rooted in long and terrible legacy of racism and abuse in the medical community. That's why in the coming days and weeks, we will continue to work with community-based leaders and stakeholders to build back this trust by spreading information about the safety and importance of the vaccinations. So to our Black and Latinx residents, let me assure you that COVID-19 vaccine is in fact safe. Why do I say that? I say that because of the various medical studies that have been done. I say that because Black and brown folks have been part of the pool of folks who have been tested during the trials. I say that because here locally, we have a diverse group of healthcare experts who have looked at and examined the protocols that were used to bring these vaccines to markets. People who look like you and me, who have examined the data and have made a determination whether it was Pfizer or Moderna, and they will do the same thing with any other vaccine that comes online to be able to give you confidence that this vaccine is, in fact, safe and necessary to save lives. In order to obtain complete protection from COVID-19, you must get the first dose, but come back for the second dose, just as these 5 did today. Until you receive that second dose, you can't be considered fully inoculated. And even then, until widespread vaccine distribution becomes a reality, it is essential for everyone to remain vigilant. Until we are able to make sure that the vast majority of Chicagoans have access to the vaccine, we must continue to adhere to the public health guidance that has gotten us this far. Wearing a mask when you are in public, social distancing, limiting your contact with others, limiting the amount of times that you're in crowds, and of course, continuing to wash your hands as we have been talking about for a very long time. For more information about the vaccine, please visit chicago.gov/COVIDvax, VAX. That's chicago.gov/COVIDvax. As I've said before, these vaccines are indeed our light at the end of the tunnel, but we are still months away from being out of that tunnel. And let me pause for a moment about that. I want to echo what I said this weekend on social media. We as the city of Chicago have already distributed 95% of the vaccine that we've received. That's the good news. But the challenge is this. We do not have enough vaccine. So I say this in the waning days of this current federal administration, but I also say it to the incoming administration. If you want to have us bend this curve and give people confidence that they can resume their normal lives, there must be an exponential increase in the amount of vaccine that is available to cities and towns all over this country. At the current rate that we are going, it would take us a year and almost a year and a half to vaccinate all of Chicago. That is way too long and frankly unacceptable. Now, whatever problems there were before, we can't solve them, but we have an obligation to solve them going forward, and solve them we must. The federal government absolutely 100% must step up, must bring together the pharmaceutical companies, must make sure that there is much wider spread production of the vaccine so that we can bring hope to our residents in Chicago and all across this country. We cannot delay any longer. We were promised 20 million doses by the end of 2020. The federal government came nowhere close to meeting that mark. Lives are at stake. It is essential that in the waning days of this current administration and the incoming administration, that they step up those efforts and deliver on the promises, because lives are hanging in the balance. Federal government has to step up, finally, and do a better job of protecting American lives against this terrible virus. We have to do that. We owe that to our residents. We owe it to the ones who are fearful. We have to do a better job. We have built the infrastructure in the city of Chicago to deliver, but we need the doses to be able to do just that. So with that, I will close, and I will welcome Dr. Arwady to the podium. But I want to say, Happy New Year. Hope is on the horizon. Please continue to be diligent. We need to get through these next couple months, and we need your help in order to do that. Dr. Arwady.
Good morning. So again, congratulations to the 5 of you. We really wanted to do an event surrounding the second dose because there hasn't been as much discussion about the second dose. But as I said a minute ago, it is not enough to get 1 dose of COVID-19 vaccine based on the vaccines that are available today. It's that second dose coming 3 weeks after the first one for Pfizer or 4 weeks after the first one for Moderna that really gives you that full measure of protection. Our data has continued to be excellent related to safety and excellent related to efficacy. There have not been surprises at this point compared to what we saw in the trials, what we've seen in the real world. There have been more than 4.5 million people who have received their first dose of COVID vaccine across the United States. There have been a very small number of allergic reactions, but again, we monitor for those. We're prepared if they happen. We've been meeting with allergists in Chicago just to make sure our protocols are good, or if we were to see anything unexpected. If you have an allergy to food, to bee stings, to dogs, to environmental allergies, you should get the COVID vaccine. Have a conversation with your doctor if you have questions about that. But I don't want people feeling worried about this history of allergies and making a decision not to get the protection against COVID. Also, I do just want to emphasize the point that I have heard a number of people have some of these side effects after they get the first dose of the vaccine. I was able to get my own first dose of vaccine, and I had just a little bit of a sore arm. I didn't have any of the fatigue or the headache or the fever that some people do have. But if you have those side effects, those are just a sign that your immune system is working. It is teaching your body how to protect you against COVID. It is absolutely impossible for a COVID-19 vaccine to give you COVID-19. So these 5 today, the beginning of second dose. What that means here in Chicago If you'll recall, back 3 weeks ago when we started, we received 23,400 doses of Pfizer vaccine. That went out to all 35 of our acute and specialty hospitals here. That means this week we got 23,400 second doses, which also go out to all 35 of those hospitals. We're working behind the scenes to make sure that everybody who gets that first dose also gets that second dose, the same place that they got it, the same vaccine, with all of the record keeping. But in addition to that 23,400 that are coming around for second dose, we are receiving additional new doses of vaccine. And typically when we're providing these numbers, like the mayor talked about, we're talking about our ability to vaccinate new Chicagoans, because that, of course, is how we expand. It goes sort of unspoken that behind the scenes we're doing that second dose. So this week we are receiving 16,575 Pfizer doses and 16,575 Pfizer doses and 16,200 Moderna doses. The great majority of those Pfizer doses continue to go to our hospitals. I want to just say a quick word that if there are people who are employed at Chicago's hospitals who have not yet taken advantage of getting a COVID vaccine, please get it now. There's enough vaccine for you in those acute care settings, and we're not seeing, as you heard, as much uptake in some of the people who may be in more support roles, particularly among Black and Latinx healthcare workers in hospital settings. We're not seeing as many people stepping up and saying, I want to get the vaccine. So please, there's enough for you if you're in that inpatient setting, and what we're doing now is expanding more and more to outpatient settings. Last week was when we started directly delivering some vaccine to some of our larger outpatient settings that see a lot of COVID patients. That work is continuing. I want to remind you that if you are an outpatient healthcare worker in Chicago, there is vaccine for you. It will be coming sort of over January and potentially February, given how quickly we're receiving vaccine. Here, getting less than 33,000 new doses this week is not enough vaccine to be able to reach all of the outpatient healthcare workers that we'd like to right away. Just in the facilities that have filled out our survey, and again, if you're an outpatient healthcare provider, we're asking all practices to register. If you go to chicago.gov/COVIDvax, the healthcare provider section, you register as a practice. CDPH is working to send vaccine to your practice or get you appointments in our pods, like at Malcolm X, or get you affiliated with a hospital or a pharmacy or other partners. We've had more than 5,000 healthcare facilities, outpatient, reach out looking for vaccine. More than 115,000 outpatient healthcare workers. That adds to our more than 105,000 in hospital settings, and that doesn't include all the people we're still looking to reach. So we are expanding very quickly. Long-term care facilities are a major focus right now. You heard me last week talk about starting with, I believe, 28 clinics. We're adding another 43 this week. We've got 128 of our skilled nursing facilities and assisted living facilities to go, but we already have more than 250 of these settings where people are living in congregate settings like behavioral health or developmental disabilities, needing assistance and needing vaccine. So we're scheduling those just as quickly as we can. Again, if you work in a long-term care facility, or you live or have a loved one in a long-term care facility, please, the opportunity is now. When the vaccine strike team comes, please make sure you've gotten your questions answered and are feeling confident about taking that vaccine. We are continuing to work to push vaccine out just as quickly as we receive it. Everything is going very well on the logistics front. Everything is going great as far as safety. Everything looks good as far as efficacy. But we need people to recognize that we have to keep doing the things that we know work. We're all going to be wearing masks and social distancing and being careful about those with underlying conditions for a long time. I also want to emphasize that just because we're starting to see vaccine, this doesn't mean that you should not get testing if you are having symptoms of COVID virus or exposure to COVID virus. Chicago.gov/coronavirus. Right up at the top, there's a testing link. There's all kinds of information in there. We add to it almost every day. How you can get testing at home, how you can get testing in the Chicago Department of Public Health sponsored sites, how you can get testing through your medical provider, how you can get testing through a whole range of ways that make it easy for you. So please don't delay. We want to make sure if you have symptoms, you get tested. The last thing I'll note is we're getting a lot of questions about when is Chicago, quote, moving on to the next phase. Just as a high-level reminder, phase 1A that we are in now is about getting our healthcare workers vaccinated and getting members of the long-term care facilities and then other congregate settings vaccinated. We are not anywhere close to done with that phase. As we look ahead to 1B, that will be when we're able to start expanding to older Chicagoans and to some of the frontline workers that have really borne the brunt of a lot of these exposures. But I do not anticipate that happening until next month at the earliest. The CDC has set some benchmarks for when we move between phases. One is when demand appears to be met, when our appointments are going less than 80% filled for days. Let me tell you, we're opening appointments right now. They're filling up like that. Number two, when our supply of vaccine increases. You're hearing we need more vaccine. In no way do we have a supply of vaccine that is exceeding demand. Number three is when most people in that current phase are vaccinated. With hundreds of thousands of healthcare workers and folks in these congregate settings, unfortunately, we are a number of weeks away from that. Or when there is any vaccine supply in a location in danger of going unused. We're pushing out more than 95% of the vaccine. Literally, I was looking this morning at the numbers. The vaccine in the warehouse is the vaccine that we've received today, and we'll be sending out to our to our hospitals that need that second dose, as well as the first dose, as well as a little bit that's in reserve as we continue to add outpatient facilities. So we're pushing this out. Vaccine's going well. Please, if you have questions, educate yourself on the website, talk to your healthcare provider, really encouraging people, when you have an opportunity to get vaccinated, take that opportunity. And with that, I'm really pleased to bring up Jose Sanchez, the CEO at Norwegian American Hospital.
Good morning, and thank you, Dr. Arwady, and thank you, Mayor, for actually being here. Buenos días, espero que tengan un buen año, muchas felicidades en el 2021, así que le deseo todo lo mejor a todos. Today is actually an incredible and a great date, and I'm saying that because it's evidence of what's going on here today in this room, thanks to our Mayor, thanks to Dr. Arwady for being here. My name is Jose R. Sanchez. As you know, I am the President and CEO of Norwegian American Hospital. On behalf of our hospital, Board of Trustee and Board Chair Rick Blabolil, who is here. Rick, raise your hands. Glad to see you here. Who is here with us today. I want to welcome and thank all of you for joining us in this very special day. I especially want to thank the Mayor of the City of Chicago, Lori Lightfoot and Dr. Allison Arwady, the Commissioner of the Chicago Department of Public Health, for the presence with us today. The Mayor's focus on administering vaccine to minorities most affected by the virus has been phenomenal, and her commitment to the well-being of all healthcare workers across the city deserve much recognition. Thank you, Mayor. Mayor Lightfoot present here with us today is a sign of her commitment to address the unique issues faced by minorities because of this devastating virus. And we are very grateful that she has selected Norwegian American Hospital as a healthcare partner in the effort to resolve the same issues in the marginalized community served by our hospital. As of today, we have vaccinated over 500 individuals from our workforce. That's really significant. Our vaccination program is still open to all healthcare workers with our hospital, and we receive a distribution of the new vaccine each week from the department, from the city, Chicago Department of Public Health. Dr. Arwady, thank you so much for your leadership and distributing those vaccines. We also continue our outreach efforts with our workforce and providers regularly to ensure they know this vaccine is immediately available to all of them. Today marks another pivotal moment in our battle against COVID-19. So we are delighted to host this second dose of this vaccine for the 5 healthcare workers who received their initial dose on December 17 at the Loretto Hospital. Throughout this pandemic, these healthcare workers have focused on the health and well-being of patients in our communities, and we are grateful for them to their efforts, and their well-being is still the foremost priority for all of us. Facilitating as many vaccinations as possible for healthcare workers priority here at Norwegian American Hospital. Right now, this vaccine is the most essential tool we have to protect all of us and restore us to normal life. Currently, the city positivity rate is approximately 9%, and I stand to be corrected. However, at Norwegian American Hospital, the positivity rate has been approximately 30% for the last 8 weeks. It is actually disproportionately affecting our community more than any other group. So minorities are disproportionately suffering and dying from COVID-19 and in alarming numbers in underserved communities with high minority populations like ours, and we are consistently raising awareness of these types of healthcare disparity we have seen in our community. This virus has negatively affected the well-being of so many individuals in our community, and I will tell you that is pretty scary. There are no question the physical, emotional, and psychological effects of this disease are deep and can lead to long-term effects. As reported last Wednesday, December 30, by the New York Times, many rehospitalized patients have respiratory problems, but some have blood clots, heart trouble, sepsis, gastrointestinal symptom, and other issues. This was stated by Dr. Vineet Chopra, Chief of Hospital Medicine at the University of Michigan, who co-wrote the Michigan study. I quote, "It is there and it is real." Let's not lose sight of these continued challenges, because it is likely that well after this pandemic ends and post-COVID, the impact of these associated conditions will still be prevalent in our community and will require a response at the healthcare industry level. So we're going to see that the people who are being affected the most will continue to be affected the most because all of these underlying conditions post-COVID. We here at Norwegian American Hospital have already begun discussions surrounding this, and we are well prepared to address those issues, our commitment to the community of Humboldt Park. Despite all of the challenges, the continued commitment of healthcare workers here at Norwegian American Hospital and the city has been unprecedented and should not be underscored. These individuals put themselves at risk every day to care for so many of us. These individuals are our heroes, and some of them have been lost their own life in the struggle to put an end to this deadly disease. I want to commend all of those who received their second vaccine today for their hard work and dedications to all of us. Thank you for your commitment. In addition, as someone who has survived COVID-19 and received excellent care here at Norwegian American Hospital, I want all of us to continue recognizing these incredible individuals across the healthcare continuum for their unwavering commitment to care for others in the hospital communities that we serve. In closing, I want to emphasize that just as the Mayor Lightfoot and her administration to continue to accomplish for the city of Chicago, we will continue to combine our healthcare advocacy efforts with other healthcare leaders, safety net hospital, social service agencies, and legislative officials. We are committed to making a difference and improving outcomes for the patient we serve by improving access to quality, compassionate health care for underserved minorities in the community we serve. On behalf of Norwegian American Hospital and the Board of Trustees, we appreciate your presence today, and we are very grateful for this opportunity to share our success with all of you. Please continue to keep up a great work that you all are doing. Be safe, and thank you for this opportunity. And I really want to applaud all of our healthcare workers for the work that they have done here. And next, it is my pleasure to introduce my colleague and friend, Mr. George Miller, President and Chief Executive Officer of the Loretto Hospital. George and I are very strong partners in addressing health disparities in all of the communities in our city here. George, please.
The Texan road.
Well, first, let me say thank you to Mr. Sanchez for inviting the Loretto Hospital to be part of this. 3 of our team members over here, so thank you for coming. I want to start off by saying to God be the glory. So on behalf of our Board of Trustees, our medical staff, and our senior leadership team, we are humbly proud for the distinction and honor, thanks to Mayor Lori Lightfoot and to Dr. Allison Arwady, that the Loretto Hospital was the first hospital in Chicago to receive and administer the COVID-19 vaccination. This distinction and honor by the Honorable Mayor Lightfoot and also Dr. Arwady is absolutely amazing. And the fact that we were invited to come back here for the second dose is a true testament to their leadership, so we want to thank you very much. Also, I want to thank my friend, my colleague, my brother from another mother, Mr. Jose Sanchez, for involving the Loretto Hospital in this second round of COVID vaccination. So thank you very much as well. We want to thank our heroes, as Jose just said, the physicians and our team members here at Norwegian American Hospital and the Loretto Hospital, who for over 10 months have cared for and treated COVID-19 patients. I liken them to heroes of a fireman, a policeman who rushes into a disaster. Our team members, both here and at the Loretto Hospital and the other hospitals around Chicago, come to work every day knowing that this hideous virus is still with us. This is a date that we'll remember, along with December 15th, when the first dose was given and now the second dose. This is something that we now know. Dawn is breaking. Light will be shining soon. We are very proud to be with Norwegian American Hospital today for the second vaccination. Mayor Lightfoot and Commissioner Arwady, thank you for helping both Norwegian American Hospital and the Loretto Hospital be the focus in Chicago of the real enemy that is disparities and inequities in healthcare that exist in Chicago and this nation. COVID-19 has shined a bright light that existed before these dread disease came on. The fact that there is a difference of 20 to 30 years of life expectancy, communities that are less than 10 miles apart, is wrong, and it is a shame. We have to do better. One step was taken by Mayor Lightfoot's administration by honoring both Norwegian American Hospital and the Loretto Hospital to receive and administer the very first and second COVID vaccinations in Chicago and Illinois. Because of these efforts, the mayor is shining a bright light on the issues for communities of disparities. Also, Mayor, I need you to know that CNN showed both me and Dr. Anash Ahmed, our COO, receiving the vaccination live at 1 o'clock last Wednesday after we met with you because of what you did. Because of that, people of color can now know that I took it along with others in our community, and the fact that the vaccination is both safe and effective for people of color, and to end the threat of the virus for us individually, but also to make sure we not give it to others, a dual benefit. The variant of COVID is now in America. You heard yesterday the Prime Minister of Great Britain shut down the entire country is here, and the vaccination scientifically is the only known hope. Take the vaccination. I implore you. In fact, one young man who used to work for me about 30 years ago saw me on national TV, and because of our work, he sent us a check for $10,000 and said, keep up the good work, because he saw that. So thank you, Mayor. Jose, I wouldn't normally share that with you, but yeah. Please also allow me to say to all people of color that the leading scientists for the United States government and the world-renowned and respected National Institute for Health, NIH, who led the development of the COVID-19 vaccination that does not contain COVID-19 in its vaccination is an African-American woman, Dr. Kizzy Colbert. In addition, let me be clear, as proud as we are of Dr. Colbert, what Martin Luther King said in Chicago over 55 years ago, of all the forms of inequity, injustice in healthcare is the most shocking and inhumane. I'm here today to only report the facts, and there's still racism and injustice today. In light of the recent death of an African-American physician in Indiana, Dr. Susan Wilson, who died from COVID-19 because she was not given appropriate care in that hospital. We talk about education to be the difference. She was a physician and died in the Indiana hospital. We cannot let that stand. We have to speak loud and speak truth to power. This event brought back to my mind the ongoing protests after the deaths of George Floyd, Ahmaud Arbery, and Breonna Taylor. Some people say that we want to become anti-racist. Fine. But I find it necessary once more and again to call out and speak truth to power about this racist and inhumane treatment of any human being, let alone one of our own, a physician, Dr. Susan Wilson, right next door in Indiana. That's wrong. I am outraged and insolent about these atrocities of blatant and outrageous racism. We must do more. We as a healthcare system, being anti-racist means that ridding yourself of racist attitudes, beliefs, and behaviors, but it also means that we have to be active in fighting these disparities and inequities and do not let them exist. Again, we have to thank the mayor and Dr. Arwady for what they've done as a first step. We appreciate that. But as safety net hospitals, Norwegian American Hospital and the Loretta Hospital need more resources. We need more funding to take care of the poor and vulnerable populations who are adversely affected and disproportionately affected by the social determinants of health in general. As I said, the difference between downtown Chicago and where I am in the Austin community is 20 years of life. You lose 20 years of life in a 20-minute drive. That's just wrong. We need more help with resources and funding. Again, I thank Mayor Lightfoot and Commissioner Arwady for doing your part and making the first step. We appreciate you and we value the work that you do. We salute you. We look forward to working with you to solve many of the healthcare inequities and disparities. Thank you very much, and thank you for the opportunity to say a few words this morning. Now, I'd like to introduce Dr. Geraldine Luna from the Chicago Department of Public Health. Thank you.
Muy buenos días a todos. Soy la doctora Geraldine Luna, directora del Departamento de Salud Pública de Chicago, y es un placer estar aquí con ustedes y feliz año nuevo a todos. Lo que acabamos de presenciar es un paso hacia adelante en nuestra misión de vacunación. Decididos a vacunar a nuestros trabajadores de la salud en hospitales, centros de atención a largo plazo y al personal que trabaja en clínicas de salud, estamos aquí hoy, en el Hospital Norwegian American, un invaluable aliado para nuestra ciudad para detener la propagación del COVID-19 en nuestras comunidades predominantemente latinas y afroamericanas, como Humboldt Park. Los trabajadores de la salud han estado tratando a pacientes con COVID en algunas de nuestras comunidades más afectadas. También han brindado las pruebas de COVID, atención médica y recursos necesarios para los residentes más vulnerables durante los tiempos más difíciles de la pandemia. Como sabemos, el COVID-19 ha impactado desproporcionalmente y devastado a nuestros habitantes latinos y afroamericanos, quienes de por sí lidian con condiciones preexistentes que los hacen particularmente vulnerables a los impactos del COVID-19. Estos conciudadanos no tienen el privilegio de poder trabajar desde sus casas y resultan presentándose enfermos a sus empleos por miedo a perder el trabajo. No pueden darse el lujo de permitirse quedarse en casa para pasar la enfermedad y permanecer un día sin sueldo para poder apoyar a sus familias. Estas personas son las que también se demoran en buscar cuidados médicos y cuidados de la salud porque no tienen seguro médico y no pueden pagar sus tratamientos. Es una gran injusticia la que vemos. Pero no nos equivoquemos, estas disparidades son el resultado de décadas de discriminación sistemática y desinversión. Aún así, por muy insuperables que parezcan, se pueden prevenir. El primer paso como ciudad para alcanzar y cosechar los beneficios de una distribución comunitaria equitativa en servicios de salud es ganarnos la confianza de nuestro pueblo, de los habitantes latinos y de color, para que se sientan seguros al recibir la vacuna. La vacuna del COVID-19 es segura. Ha sido probada exhaustivamente sin omitir pasos durante el proceso de investigación. La vacuna es un proceso que requiere de 2 dosis para obtener la protección contra el COVID-19 que se requiere. Hasta que no reciba la segunda dosis, no se puede considerar que esté completamente inmunizado. Debe regresar por esta segunda dosis como lo han hecho estas 5 personas que tenemos aquí. Y felicitamos. Recuerden que hasta que la distribución general de vacunas sea una realidad, es esencial que todos permanezcamos atentos y sigamos las guías de salud pública necesarias para detener la propagación de esta terrible enfermedad. Sigamos utilizando las mascarillas. Sigamos lavándonos las manos con regularidad, manteniendo un distanciamiento social, quedándonos en casa cuando sea posible y evite viajar. No tenga invitados en su casa que no vivan con usted. Para obtener más información sobre la vacuna, visite chicago.gov/COVIDvax. Y como ha dicho la alcaldesa, estas vacunas son la luz al final del túnel, pero todavía faltan meses para salir de ese túnel. Por eso debemos seguir trabajando juntos y fomentando la confianza de nuestras comunidades para que podamos construir un Chicago mejor, más saludable y más equitativo como todos merecemos. Gracias.
And now happy to take any questions you have for any of us.
Well, I guess we can start on topic, Mayor, if that's all right. Some questions might be better for Dr. Arwady. I'll let you all respond.
Well, let's start with on topic. Is that what you're saying?
Yes,
Yes.
yes.
Okay.
Out of respect for the topic. I think it was Dr. Arwady had said that you're not seeing as many frontline workers getting vaccinated, especially in Black and Latinx workers. Can we get a little more information on why perhaps that is? I'm just getting emails coming in.
I'm not sure your paraphrase is correct, but I'll let the doctor speak first. So.
Yeah, so let me put a little bit more detail on it. And we are really actually still exploring this, right? We're just in our first few weeks of vaccination. Really, this week is the first week that we're broadly able to say there's enough vaccine available for inpatient settings. But what we have heard anecdotally is that in some of our hospitals, it's actually the word frontline, meaning the people who are most directly caring for COVID patients, actually are quite often raising their hands. The doctors, the nurses, the people that have very directly perhaps seen seen COVID the most or are at the highest risk themselves. But we're not seeing as much uptake, again, anecdotally, and we'll be getting some more direct information, that perhaps some of the other support staff in the hospital who are equally important to get vaccinated in this setting, whether these are people working in environmental services, whether these are people working in food service, people working in the laboratory, people broadly working in that setting, there is vaccine available, and we want to have people vaccinated across the hospital spectrum. What we have seen in the data, both if you look at some of the geographic information that is online, as well as we're starting to just get some preliminary data related to race and ethnicity that, again, we're working with the state and we'll be able to share in more detail, is that we are seeing more white and Asian healthcare workers raise their hand first, which does not mean there are not a lot of Black and Latinx healthcare workers also raising their hand, as we've seen, but we are seeing somewhat more hesitation. And I don't know that that's unexpected based on surveys that we'd seen, or just, the fact that there is a history there that has to be acknowledged. And I think it is incumbent upon everybody to make sure that we are sharing information and addressing hesitation head on. So what we are asking now is for the hospitals, for example, to all go back and do a second pass. If you're getting to a point where you don't have people, signing up very, very fast, now is your chance to go back, make sure it's available for everybody. So it's not at all a problem of not seeing vaccine uptake. We just want to make sure that vaccine uptake is equitable. And all of our hospitals are doing a good job in terms of pushing vaccine out. And in fact, some of the ones that serve predominantly Black and Latinx communities, we're seeing some of the highest uptake there. So I don't want to give at all the impression but we are seeing in some of that disparities, particularly in some of the larger hospitals.
Maybe you can stay there for just a follow-up,
Sure.
if you would. Sometimes asking, you seeing any issues with the supply or distribution of either of the vaccines, and any hiccups in the rollout that you've seen so far?
No, I think really locally things have been going very well. We're set up to be able to hold more than 130,000 of that ultra cold vaccine should we need it. And many of our hospitals increasingly also have their own capacity to hold some of that ultra cold for Pfizer. We are using Moderna in outpatient settings at this point. So that would be our outpatient clinics, our long-term care facilities, where there is more opportunity for some flexibility in terms of timing. But we have a lot of work going on behind the scenes to really make sure we're monitoring temperatures, we're making sure the first and second doses are getting there. We're still fixing, there's been a few hiccups on the tech side related to some of the reporting, for example, making sure that the electronic health records are all connected to the registry. But by and large, it's been going well. And again, we're pushing out vaccine just as quickly as we can get it. So hopefully if we can get the vaccine production up over the next few weeks, we'll be able to move even more quickly ahead, really get through 1A, start to push into 1B. And then I know a lot of people are anxious to get vaccinated here in Chicago. We're anxious to get it for you. It's just a matter of having enough vaccine. One last thing I'll say on that is, again, as we've been looking at some of the more specific data, 42% of the doses that we are giving in our Chicago institutions are going to people who are not Chicago residents. So that's fine because they're working in Chicago hospitals. But where we report out our data, we report on Chicago residents. So there are many more people getting vaccinated who may be residents of suburban Cook or others. So we're getting a sense of what some of these vaccination patterns looking like. We'll make adjustments as we need to, but broadly it's been going very well.
Mayor, perhaps this is best for you regarding the vaccine and what happened with the pharmacist in Wisconsin. What steps are being taken here in Chicago to make sure that any intentional mishandling of the vaccines can be prevented?
Well, as you might have imagined, when I heard about that case, the first thing I did was call Dr. Arwady and say, security do we have? Look, I think as we're learning more about that individual, obviously in my humble estimation, he's got some serious mental health issues. He's somebody who probably shouldn't have been in a healthcare setting, and I hope that some actions are being taken, not just from a criminal standpoint, but I think the folks in Wisconsin have to ask themselves whether or not this person should be licensed in the healthcare system at all. There are protocols that are in place, and I don't want to go into all the security protocols that we have here. But look, the reality is if somebody who has an agenda, as this individual did, and doesn't care about the sanctity of life, as he clearly didn't, is intent on doing something, even the most rigorous protocols are going to be challenged to stop that. The good thing about that happened there is they figured it out, and they figured it out quickly and took the steps, it sounds like, that were necessary to notify those that were involved. What I've read is both the vaccine companies have said the heating it up at room temperature doesn't cause any physical harm or injury, but obviously, believe me, that was one of the first questions I started asking about what our security protocols are, and I'm confident that we have the right controls in place. I'm just hopeful that, and I have every confidence of the people here in the city of Chicago. I mean, every single healthcare worker that I've talked to, frontline, nurses, doctors, everyone that is supporting the healthcare ecosystem in the city and has been under siege, under pressure, under great sacrifice for 10 plus months, understands the importance of this moment and the opportunity that it presents to literally save lives. So I have every confidence that it's the cautionary tale for sure, but we understand what we need to do to take care of business here in the city of Chicago.
We look over the UK and this new strain of the virus coming through, forcing them to shut down their schools. In light of CPS beginning its reopening plan, is the city concerned about the timing of this and whether it might have to reclose CPS if this virus strain?
There's no indication that the challenges that the UK is now having again, this is probably the fourth or fifth wave that they've had, are something that we are facing here in Chicago. I'll let Dr. Arwady speak to the public health efficacy of the measures that we put in place. Look, here's what I would say is certainly understand the concern of teachers. Absolutely understand it, which is why CPS has been so committed to engagement with union leadership. 49 meetings and counting is, I think, strong evidence of a commitment to being in partnership with the CTU. We wanted to meet every single day this week, and they initially told us no. I'm told this morning that now they want to come back to the table, which is good news. It makes sense for us to be in partnership on this. Why? Because our children's lives are at stake. Our children's educational future, our children's ability to prosper by being in a safe and nurturing school environment is critically important. And what I would say to others outside of the school system is do this. Go into your neighborhood schools. Elected officials, go into your neighborhood schools. See the measures that have been put in place in those schools. Also, drop into e-learning classes, as I have. And what I think you're going to see is it works for some, it absolutely fundamentally doesn't work for others. When I saw, as I did yesterday, 3 and 4-year-olds who were trying to figure out how to mute and unmute themselves on a computer. 3 and 4-year-olds. When I saw kids with special needs trying to figure out how to navigate the computer where they clearly needed somebody in the room with them to help them. When I see that, what comes to me is a question of equity. We can't write off the school year, as some have said to me privately, which inflamed me. Writing off a school year is writing off children's lives. We have talked a lot today about equity, about what we need to do to make sure that Black and brown Chicago has the same opportunity to live healthy, vibrant lives as anyone else. That necessity is no less urgent when it comes to our children. And what I'm concerned about, of course, is safety, of course. And I think that working with the Department of Public Health, the Chicago Public Schools have put in place and gone over and above what we've seen at the Archdiocese schools, at the charter schools, at the private schools in the city. We're in constant conversation with them. But what I also know is it makes a big difference in the child, in the lives of a Black or brown child who doesn't have the same kind of access to educational excellence as someone else. And so what this really is about, obviously parents have the opportunity to make the choice that is best for them and their family. But why would we set up a situation where if you're wealthy and you're white, you get a set of options that if you're poor or working class and you're black and you're brown and you do not? We have an obligation. I think Dr. Jackson said this very eloquently today. We have an obligation to level the playing field for our children so that they have the same kind of educational opportunities as anybody else, regardless of wealth, zip code, immigration status. That is an obligation that I take very seriously. And again, we want to work with the teachers. We want to work with the staff. And I have to say, I salute those staff who, by the way, have been in our buildings all year long. Those frontline workers there, the cafeteria workers, the janitors, the security folks, they've been in those buildings all year round doing what is necessary to make sure that those buildings are safe and that there's an environment in which when we came back to school in September, the teachers who came back, the assistant principals, the principals, and the other staff could do so safely. And that's exactly what we've done.
Any chance teachers might be able to jump the line in getting the vaccination because of the concerns about schools?
Well, we're very interested in making sure that teachers are in the queue in the next round. Again, we've got to finish the work with our healthcare workers. I think that is most important. You know, one of the reasons I haven't taken the vaccine is I don't think it's appropriate for me to jump the line ahead of these workers who are on the front lines. But absolutely, we want to make sure that teachers are in the queue for the next round. But I'll say it again, we have got to get more vaccine. We can't create an expectation of hope for people and not be able to deliver. That would be the worst kind of cruelty that could be created. But we are dependent upon the federal government to step up, finally, and do its job. And the thing it can do is make sure that there is sufficient vaccine all across this country, and they have not done that yet.
Off topic, if we could, Mayor, there is a new video that has been released today with the woman on the South Shore who was hit by the Chicago police car, Martina, looking for her name here. Anyways, have you seen this video?
What's her name?
Martina Stanley.
I have not seen the video.
You have not seen the video?
No, so I can't comment on something that I haven't seen, but obviously I'll look into it.
This happened a year ago. The city fought the release of it for an entire year. There are complaints about transparency.
I don't know any of the circumstances here, but I will look into it.
Let me ask you, since we didn't get to chat with you after the emails came out and after you had your meeting with Anjanette Young, can you tell us, what you said to her and what she said to you during the course of that meeting?
Ms. Young and I made a commitment to each other that we would keep the content of our discussion confidential, and I intend to honor that. I was grateful for the opportunity to be with her. I, not surprisingly, apologized to her in person on behalf of the city, and I've said this over and over again, and it remains true. What she went through is absolutely fundamentally unacceptable. She was denied her basic dignity as a human being. And we can't have that. And there has to be accountability for what happened to her. And the Civilian Office of Police Accountability is continuing its investigation, so I don't want to go too far there. It's important that investigation gets done and that it's done independently, and they call balls and strikes. But what I will say is she's an incredible person. She is smart, able, and given the horrific trauma that she endured, she's still leaning into her faith as a woman of faith, and I am confident that she will get on the other side of it, and I'm committed to doing everything I can to help her and every other victim out there.
This is from Heather Sharon. I'm just going to read this one directly. Since the emails were released before New Year's Eve, show that your staff briefed you in detail about the raid. Will you reconsider your decision to appoint Judge Williams and Jones Day to investigate the raid, since part of that probe will be to examine your conduct, including the incorrect statements you made to the media?
Yeah, I will push back on one effort. I don't want to quibble, but I think the emails speak for themselves. There was a brief discussion about the reporting that was planned by CBS 2. My understanding, based upon, and I don't have any contemporaneous recollection of it, I was out of the office for most of that day. It was Veterans Day, and many events that day. But my understanding from looking at the emails is that I was informed that Ms. Young was going to be getting the videos the next day. Now, apparently that obviously didn't happen, but that wasn't something that was brought to me. So I don't think it's correct to say I received a detailed briefing. That's just not correct. Obviously, what I did in reaction to learning about the reporting was to press again on fixing the systemic problem that was leading to too many officers going into homes for which there was absolutely zero evidence of criminal conduct. And I think that was a proper focus for me. But with the benefit of hindsight, I wish I had asked more questions and gone deeper into Ms. Young's individual case. And one of the things I specifically said to her when we met.
Well, let me just follow up on that, because many people look at the egregious nature of this, and the emails indicate that there was sufficient information provided to you that she was handcuffed naked for 40 minutes. People wonder, how could you possibly not remember a case like this, especially involving a black woman who was treated like she was?
Well, again, I would say look at what was actually provided to me as opposed to what was in the emails. As I said, what I focused on that day is this is too much. If you look back at the reporting, I started talking about these cases in the summer of 2019. I think as early as July. And I made a commitment at that point that we were going to fix the systemic problem that was leading to these cases. And that's precisely what I focused on and what we did. We implemented new search warrant protocols that went into effect January 3rd of 2020. Key among them, in my view, was that if there is a so-called wrong raid, it's incumbent upon, and I won't even say incumbent, it's mandatory for the officers to open up a CR investigation so we learn real time what happened. Look, if I could turn back the clock and do things differently at that time, I absolutely would. But based on the information that I had in front of me, I focused on the systemic fix, because there was seemingly every single week, there was a new one of these cases that was popping up, most of which happened before I became mayor. But because they were popping up on my watch, I wanted to do something to fix them. And we took those initial steps that went into effect a year ago. We're re-looking at the work that was being done. It's a daily topic of conversation now with me and my staff and the superintendent, and I believe that we're going to get to a better place, and I believe that Ms. Young will be part of that work of getting us to a better place.
There were a couple of questions. Well, I need to ask you whether the City Council Safety Committee meeting today to consider the updated versions of CPAC and GAPA. Bill Cameron, Alex Nick, and wondering along the same lines, how soon would you like to see the City Council pass some kind of compromised community police oversight ordinance, and what should it look like?
I think we have to get it right. That's the focus. And there's a lot of different perspectives on that issue and what getting it right means. So there will be more conversation. We engaged in conversation with members of the City Council over the break about what that looks like. But what's most important is getting a structure that makes sense, that is reflective of true community oversight, but also is supportive of the work that must be done regarding the consent decree, and striking that balance is going to be important. When the effort started with civilian oversight of the police department, we weren't in a consent decree. We are now. And so whatever the end result is has to reflect that reality and make sure that we're striking the right balances. This is not easy work. If it was easy, we would have done it already. But I'm personally involved, and I'm confident that we will get to the right place and be able to present something to the City Council for a vote as soon as we are able.
Can I ask you quickly about Kenosha?
Hey,
Are there preparations here in Chicago in case things go,
Craig,
in case something happens in
Craig,
Kenosha?
you're shameless. She said last question.
I just got a text in from somebody about
I will
Kenosha.
answer this very last question, okay?
Thank you.
Come on now. Start off the new year actually right. Look, we're following what's happening in Kenosha very, very closely. It's our expectation that sometime this afternoon we're going to hear from the authorities up there about what charges, if any, are going to be brought against the officer who shot Mr. Blake. So our police department is clearly on alert. We're in communications with our partners in the region, and we are prepared for any eventuality, but we have no actionable intelligence to suggest that there's going to be an issue here in Chicago. Now, look, having said that, Mr. Blake and his family are from Evanston. I've had the privilege of speaking with his father. No parent wants to find out that their child has been struck in this way. His life has been irreparably harmed as a result of what happened. Something that, I don't want to prejudge it, but something that looks like it was entirely avoidable. Now, again, I don't have all the facts. The prosecution and the courts up in Kenosha will make their decision, and I hope they make the appropriate one based upon what the actual facts are. But what I know is that when things like this happen elsewhere, whether it's Blake, whether it's George Floyd, whether it's Breonna Taylor, it feels like and resonates here in Chicago because of what's happened here. And I think a day like today tells us that we have made progress, but that we have more work that must be done. Reforming police departments, making sure that there is constitutional policing, respectful, authentic engagement with members of the community is long, hard work. It is not a notion. It doesn't happen overnight. And we are on a journey, but we've got many, many, many steps in front of us that we need to take. But the important thing is, as mayor, as superintendent, we are committed. We have the same vision for what we must do in the city to restore faith, to bridge divides, and we're going to keep doing that hard, necessary work, one relationship at a time, to do just that. Thank you.